This online preceptorship course is brought to you by the Staff Training and Development of the Nursing Department in King Fahad Hospital of the University. Welcome. This course is designed to prepare the senior nurses to assume the responsibility as a preceptor, to begin the journey from novice to expert. This will enable them to apply knowledge, skills, and competences acquired as staff into their area of practice, laying a solid foundation for lifelong learning. The Preceptorship program is a structured teaching program to facilitate nurses learning in their new role as staff members of the unit in which they are hired to work. This program incorporates schedules for classroom and clinical setting designed by the nurse educators in collaboration with preceptors. In the nursing units, we always ask, where are the preceptors? Why are the preceptees always left alone? But we need to consider that the frustration of preceptors build up from lack of time in precepting, lack of the proper tools, resources or manpower, lack of the proper structure or organization in preceptorship in a particular unit. The following are the Joint Commission requirements in the orientation. Orientees are to be evaluated on their skill level at the time of being hired. The Joint Commission International Accreditation main purpose of the orientation program is for staff development to ensure safe and quality patient care. Preceptors are expected to teach new hire during the scope of their orientation and use the assessment checklist as a teaching tool during the orientation. These checklists should periodically need to be revised by a committee comprising of staff nurses, preceptors, nurse educators, and nurse managers. The following are the benefits of preceptorship for the health organization. Enhance recruitment, improved retention, reduce sickness and absence, reduction in near-miss incidents made by newly registered nurse, personal and professional development for the preceptor in developing appraisal, mentoring, supervising, and supportive skills, increased confidence and competence for the newly registered nurse. The following are the benefits of preceptorship for the preceptee and preceptor. Confidence, professional socialization into the working environment, increased job satisfaction leading to improved patient, client, and service user satisfaction. Feels valued and respected by their employing organization. Feels invested in and enhance future career aspirations. Feels proud and commitment to working within the profession and regulatory body requirements. Understanding of the commitment to working within the profession and regulatory body requirements. Personal responsibility for maintaining up-to-date knowledge. The following are the elements of preceptorship. Preceptee or the new registered practitioner. Preceptor, employer, or the health organization. The goals of preceptorship are to provides the knowledge, skills, tools, and framework necessary for the preceptor to serve as a clinical instructor to students or new nurses in the clinical setting to support the growth and development into a new professional role. Provide new graduate or new nurses with valuable experiential learning that is essential to their success in the field. Gain confidence and experience in role performance in a supportive environment. The Preceptorship course centers on the following 5 core content objective areas: provide the educational content required for preceptor preparation. For the preceptor role, the objectives of this core content is to describe the roles and responsibilities of the preceptor and preceptee, and identify the knowledge, attitudes, and skills needed to be an effective preceptor. For the role model, the objectives of this core content is to describe the attributes of a preceptor as a role model. In educator, the objectives of this core content is to demonstrate the educational process for assessment, planning, and implementation of learning experiences. For the facilitator, the objective of this core content is to apply strategies that facilitate socialization of employee and student into work environment, and foster critical thinking. In the part of evaluator, the objective of this core content is to utilize techniques in formative and summative evaluation processes. Let us discuss what is preceptorship and a preceptor before we will discuss each of the preceptor's roles in details as a role model, facilitator, educator, and an evaluator. The following are the objectives for the preceptorship and preceptor part of this course. Define the terms and job functions of preceptorship, preceptor, and preceptee. Identify the knowledge, skills, and attitudes needed to be an effective preceptor. Identify the role and responsibilities of preceptor. Identify strategies to help preceptee overcome reality shock. Preceptorship is a period of practical experience, training, guidance, and support in a particular field by an expert or specialist for student, new graduates, and employee move into new position. The preceptor is an experienced and competent staff member who is formally assigned for a fixed period of time through role modeling, teaching, coaching, supervising, and socializing, in order to help preceptee and support them in the process of learning and adapting them to the new roles and responsibilities. The preceptee is anyone who may also be called the orientee, who is new to a facility, department, or unit, and who is being oriented by a preceptor to their new work and role. The competency talks about the skills and ability to practice safely and effectively without the need for direct supervision. Competency is determined by the measurement of an employee's knowledge, skill, and attitude in a specific role. Check the table to see the different attributes of the preceptor in terms of their knowledge, skills, and attitude. Now, let us discuss in details the preceptor roles. The following are the 4 primary roles of the preceptor. The leader's role: a preceptor should be the one to lead the group, and should always direct them to the right clinical path. Role model: a preceptor should always be someone whom the preceptees will look up to. The orientees will imitate what they are doing in the nursing units. So they have to be a role model that abides the rules, policies, and procedures of the hospital. The preceptor leads by example, demonstrating and personifying competent care nurses. Preceptor helps the student integrate clinical and professional practice. Socializer role: the preceptor actively integrates the student into the social culture of the unit and facility. Preceptor helps the student feel welcomed by peers and coworkers, and assists them in establishing relationships and becoming familiar with the written and unwritten norms of the unit. The preceptor orients the student to the nursing unit. Educator role: the preceptor has a desire to teach and share expertise with the preceptees. They are responsible for assessing the preceptees' orientation needs, planning learning experiences, and facilitating patient assignment selection to achieve identified learning needs and goals. The preceptor in collaboration with the preceptees plans and implements a teaching plan and evaluates progress based on mutually agreed upon orientation goals on an ongoing basis. The following are the essential responsibilities for effective preceptor. Orient the preceptee to the work of responsibility and service. Facilitate the learning experience. Establish the schedule for the preceptee. Guide the preceptee during assigned task. Supervise orientation and competency. Teach new skills and reinforce previous learning. Another essential responsibilities for effective preceptor are to gradually increase the preceptee responsibilities, provide timely feedback, serve as role model during work experiences, work closely with facility educators, plan specific learning experience, complete all necessary paperwork and reports. The following are the responsibilities of the preceptees. Willing to set development and orientation goal. Willing to assume responsibility for the orientation. Actively seek challenging assignments. Be receptive to feedback and evaluation. Show initiative. Be willing to learn. Fulfill all required time commitments. Demonstrate tact, diplomacy, and sensitivity in working with others. Complete all necessary paperwork and reports. If your assigned preceptor proves not good fit, notify the preceptor of your concern, and include your manager or supervisor as appropriate. The reality shock is normally experienced by new orientees, nursing interns, and new trainees in their new environment in the nursing units. Reality shock is a condition in which a person enters a profession, but finds him or herself unprepared. It is not unique to nursing, though it can certainly happen in the nursing field. There are 4 phases of reality shock, including the honeymoon phase, shock phase, recovery phase, and the resolution, adaptation phase. The honeymoon phase. Characteristics: everything is wonderful, excited. Rose-colored glasses, high energy level. Focus is on learning routines and perfecting skills. Wants to learn everything at once. Strategies for coping: take an interest. Help to set realistic expectations. Encourage to ask questions about the organization. Assist to focus on developing a reputation for competence. Shock phase. Characteristics: frustration, rejection, confusion, disappointment, discouraged because they are not grasping all the information as fast as they would. Tendency to have a negative view. Strategies for coping: be a good listener. Encourage a look at current learning status. Focus on the good things. Create a climate for learning. Prevent feelings of abandonment. The recovery phase. Characteristics: stress is reduced. Able to grasp the role. Realize the truth. Sense of humor begins to return. Strategies for coping: nurture ability to see humor in the situation. Give positive feedback. Share stories about preceptor's own first work experience. Assist to turn disappointments into learning experiences. Resolution and adaptation phase. Characteristics: adjustment begins by job hopping. Bicultural adaptation. Integration of 2 conflicting value systems. Strategies for coping: assist to evaluate work situation objectively. Help identify appropriate and obtainable goals. Discuss constructive problem solving. Thank you for participating in our online preceptorship course. If you have any question and suggestions, please feel free to contact us in the Nursing Education Office.